Hi, guys. Welcome back to Thriving Beyond the Stethoscope. While we're working on getting all of those conversations started and recorded, we're going to talk about another thing that's kind of important for y'all, especially those who are wanting to go into healthcare and starting their own business. So, probably thinking, what do I have to do to actually start my own business, especially when it comes to healthcare? First of all, you need to choose your business name. I mean, that was the hardest part for me. And I luckily had the support and help of my family to help me narrow it down and why you choose the things that you choose, right? Something that you want to be proud of, something that you can put on the wall and be just as excited about as the day that you picked it. Also, once you pick your name, you have to go online and see, is this name already unfortunately taken or is it available? And in Florida, you can go to SunBiz, and when you go on there, you can actually search for business names. So type in the name that you want, see if it's there, and if it's not there, pretty good chance it's readily available. So then you need to actually choose with your name, are you going to do an LLC or limited liabilities corporation? Are you going to do an S Corp or C Corp, which that can come later with amount of employees and money that you're going to make? There's a whole bit behind that, and you'd want to talk to an accountant because there's some tax benefits to it versus the LLC. And then there's a professional limited liability. So the professional limited liability is good for some people who are providers who own their own practice to try to keep things separate. I never went that route. I went LLC, and then my accountant recently just turned me over to a S Corp. And that's because I'll be hopefully making a lot more money here and be able to hire people, and it's just better for tax benefits. So make sure you have an accountant. That's another step a little bit later on. When you go on to SunBiz, like I said, check for the domain name. If it's not there, you can register on SunBiz. It costs about $125 these days to actually register, fill out the information, fill out the name, make sure everything's spelled correctly. You'll have to have a registered agent, which you can be your own registered agent, or you can choose somebody to be. They have different services out there that cost money to do it if you want to go that route. You really have to figure out what's best for you, but that's just part of starting your business. And you also have to have articles of incorporation. I know when I first started, I used LegalZoom just because I thought it might be the easiest. I wouldn't have to worry about messing anything up. It's quite costly if you go that way, which you certainly can, or you can do this all on your own by going to SunBiz, registering yourself, and paying them a lot cheaper. After you do that, you'll need to go on to the irs.gov and sign up for a EIN number, or your business tax ID number. It's free to do it. Takes a few days for it to come back. It was actually pretty simple when I did it for my nonprofits foundation that I've created, the Thrive Well Community Health Foundation. That's a whole nother story for a different day if you want to try to create a nonprofit and all those steps that you have to go through. You have to go through your county. So Collier County is where I'm located. You have to go through them as far as to get like your business tax receipt or your business license, essentially. In Collier County, they have a really fun thing. If you live in the city, or if your job is in the city, you not only have to do county, but you have to do city, and it gets really complicated, a little bit more money. For some people, not so complicated, I guess. But for me, I was lucky enough to be able to do work from home option, and I didn't have to do the certificate of occupancy and everything else that you need when you have a building. However, soon, coming around April, May, hopefully April, my building is supposed to be opening up here in Immokalee, Florida, so I can help the community. But that will come with more things to do, such as inspections, certificate of occupancy, a different type of business license, different types of inspections that I'll need as well too. So more to come on that. I do have a little hint, I guess, for ACA. You don't have to be certified through ACA. You can do an exemption, especially if you're a nurse practitioner-owned clinic and you're certified through at least one insurance. So that's a way around paying. It was $2,000 the last time I had it. So you don't have to do the inspections. You don't have to pay that money, which can be a lot when you're trying to start your own business, especially if you don't have the patient load to support your business quite yet. Insurance, super important, especially as a provider, a nurse practitioner, or even as a nurse, anybody, you need to have your own professional liability insurance. I use Pro Liability. They were really easy to get through and easy to choose what I needed. If you have a building, you have to have general liability insurance as well to protect yourself. And you might have to work with your accountant on as far as the workers' comp aspect to it. So I haven't quite gotten there myself, but I will be. And as soon as I go through it, I'll be happy to share what I've learned. For credentialing for insurances, I use CredX. They're with Florida, specific for nurse practitioners. They've been really great. I've had to do my own NPI number with me, which I've always had. The NPIs have their different types of taxonomies because I have getting licensed or credentialed in different areas. My taxonomy has to be family practice, psychiatry, and I'm not quite sure yet about oncology. If I'm able to provide those services after collaborating with this group I'm looking at, then I'll have to cross that bridge and let you know when I get to it. You also need an organization NPI number, and that's specific to just your organization, your business, not the NPI individual to you. You have to create for providers. You probably know this, but you have to have the CAQH or the CAC profile set up. It is a bear, especially the first time I had to do it. All that information that they wanted, you have to put it all in because these insurance companies that you're going to get credentialed with, they go through there, and that's how they credential you to be able to provide services under insurance if they allow you into their panel. Now, getting into their panel can be a whole different discussion. I actually did an interview with NP Files through our Florida professional group, which talks about insurance credentialing challenges for nurse practitioner-led clinics, especially autonomous. So I'm autonomous in family practice. I don't need to have a supervisor over top of me in the family practice aspect. For psychiatry, I do, and I actually do have an excellent collaborator. Hopefully soon, our Florida legislation is hard at work at passing, I think it's House Bill 301 right now, so we can get psychiatric nurse practitioners autonomous, so we can get help to more people, not just our rural and underdeveloped communities, which we need that, but all across Florida. We have a shortage and we need the help out there. So if you are ready to support, just write to your legislation about House Bill 301. It has to do with the autonomy for mental health nurse practitioners. Once you get all that stuff set up, if you want to have your DEA license, that's another whole conversation, about $900 later and a couple of classes that you had to take at some point. You can get your DEA license, and then you can prescribe controlled substances. Once you have all that ready to go, you can get your credentialing underway. And like I said, I use CredX. They've been pretty good about everything and trying to get things approved. And I think currently I have Medicare, Medicaid, and Humana, but we're working on many more. And that Florida Blue Cross Blue Shield is quite the bear. So these are the basics so far that you need for your medical practice. You will also want to create HIPAA compliant forms, policies, and procedures, because once you get busy, you don't want to have to think about the process and flow. You want those already ready to go. Everything smooth sailing, because if you grow too quickly, then you're not going to be able to keep up with demand. You're going to have upset patients, you have upset employees, and then you lose employees, lose patients. It's no good. Figure it all out in the beginning. I'll tell you, marketing and visibility is also key. So when I first started, I had no idea. I was just like, okay, I'm ready to hit the dirt. I'll go out there and I'll start marketing and I'll meet people. And I've had some great people tell me along the way some helpful tricks. So something called Alignable, and it's literally Alignable. It's a free marketing platform that you can sign up for. You can choose to pay extra if you like, so that you can connect more and do more. I've gotten a lot of networking from there, both local and all over Florida, since I offer telehealth for all over Florida, and I offer in-home visits now, and I'll have my clinic very soon in Immokalee, Florida. It's been great to connect with locals and people all over Florida with similar interests, because I'm more about collaboration and not competition. There's plenty of patients out there for all of us, so us to be able to support one another is really my goal. I've met some amazing people through Alignable. I've met some amazing people through LinkedIn. Again, I'm cheap right now. I'm just starting out. I'm not paying for the excess thrills and frills, but it's been really helpful to connect with other people. I've also relied on a lot of my old contacts. I've been in the Collier County area for over 5 years, and it's been really great to connect with all my other providers that I already know. So reaching out to them and just saying, hey, I'm here. I offer primary care, psychiatry, oncology survivorship support with the future hope of collaborating and being able to bring those services out to Immokalee is my main goal, because we need care everywhere. So that's the goal. You have to be able to have your website. Otherwise, if you're not marketing, nobody's going to see you. You could be the best person in the whole world, but if they don't see you, nobody's coming. Website, I ended up using Wix. Between that and GoDaddy, I'm sure there's some other options out there. Anybody can let me know what they think in the comments. But Wix has been pretty good. It can be cumbersome at times. I've also tried a free website platform, the Google Sheets, if I remember correctly. It's not quite right. It's Google Websites. And that one was free for my community health foundation, the nonprofit, because I, again, don't have a lot of money for that. So that has to build. And it did a decent job. I definitely prefer to have my own domain. So that's what I paid for in Wix. It's my own domain, which is thrivewellmedicalcenter.com. And that's really great for catching people's eye. Having Google Business Profile is an absolute must. You have to get it. You have to get reviews. I always say I feel like I'm the chick in the back that's trying to get yearbook signatures, and it feels weird asking people for Google reviews. But honestly, the more reviews I can get, the more people I can access, and the more people that I can help. So if people feel like I've helped them, I ask them to fill that out. You can also do Google Business advertising on there as well. Can be pricey depending on what you pick, but it does a good job. Social media is huge. I do a lot of social media advertisement. I created its own Facebook page. I'm trying to get the Instagram and TikTok up. I'm not the best with that either, so I actually have somebody working on that for me already, which is helpful. Community outreach is huge, especially in the medical field. So I've actually purchased a customized canopy and table cover, as well as a banner, so that when I go to events, whether outside or inside, I'm prepared. I have pamphlets that are created. I have a couple of bio cards that are created, and of course, business cards. I love my business cards. It's got a QR code on it. It can go right to the website. It's got my information on it. It's really great, I think. So I've had a lot of comments on it. I get my stuff through Vistaprint, but recently I have a close friend who owns a medical supply store, and she's been amazing too and does great pricing. So I do a lot of things through her. So I'll do more through her probably. Just anywhere I can save money is helpful so I can get going and help more people. Referral relationships or collaborations. I do a lot with community partners, a lot of outreach to them. I've cold emailed. I've gone to a lot of different meetings. So I've looked at local meetings, both in my local govern, I guess you could say, and other outreach, like Immokalee interagency meetings, Immokalee Chamber of Commerce meetings. I'm trying to go to the CRA, which is the development basically of our area. Naples interagency meetings, anything that you can do to get involved, get your name out there, get connections. You never know how your connections will help you later. At first, I felt very defeated. I felt like I wasn't getting very far. I was like, what is this, my waste of my time? I should be trying to get patients. Ultimately, that gets you patients. I remember I was at the Naples interagency meeting, and I was like, oh, I mean, this is great. I'm meeting all these people, getting all these great contacts. I'm like, but is it going to get me patients so I can help people? And it did. I had several referrals after that meeting from those providers. I have several hospital groups there that were able to take my flyer and send it out to their groups so I can help them as well. So you just never know how these meet and greets or these meetings are going to go. So stick with it. That is the overall basics of getting your business started, letting it run, starting with your marketing. A couple little other hints and tricks as far as patients go. I use ZocDoc, which works pretty well, but they charge you quite a bit once you get a new patient. And so you have to make sure you charge accordingly. WebMD, sorry, WebMD, I did not particularly care for that project. I got 0 out of that. I paid like $220 a month, which seems ridiculous now, but I was like, oh, people go to WebMD. Of course, naturally, they'll try to find a doctor on there next or provider. It did not work well, so I'll be letting them go. I feel like there's probably a couple more that I'm not thinking of off the top of my head besides Alignable, ZocDoc, social media, websites. Yeah, You got to get out there. Feet to ground. Get out there, meet people, get out of your shell if you can, or hire somebody to do it if you can afford it. Don't forget to like and subscribe to the channel. We'll have more information coming out, more experiences coming out to you. I'll be doing some education moments as well too, whether it's in psych, family practice, oncology, and then I'll also be looking to help those future students with passing their exams and tips and tricks on how I did it. So like and subscribe. We'll see you next time.